The event you are listening to will begin shortly. Please stand by.
Tuesday, we will start our briefing with Governor Pritzker.
Thank you very much, and good afternoon, everyone. Welcome back to our 2:30 public update. Today, Tuesday, May 12th, is International Nurses Day, a date that was chosen to honor the birth of Florence Nightingale, the founder of modern nursing. And it's particularly apt that this year we celebrate the bicentennial of her birth in a moment when the incredible work of nurses is more essential than ever. To all the nurses who call Illinois home, I want to share my personal appreciation and that of a grateful state for the bravery that you've demonstrated in our fight against COVID-19 and for the selfless acts that you are already doing every day before this pandemic started, easing the suffering of those who are sick and even dying. Thank you for answering the call to save lives, to comfort those in pain, and to make a difference for countless patients and their families. We are so very proud of you. And now I'd like to turn it over to Dr. Ngozi Ezike for today's medical update. Doctor?
I will start with the positivity rate statewide, which is 18%. It is important to note that the positivity rate is calculated on a 7-day rolling average with a 3-day lag. That means that for today, we looked at the number of positive and total tests reported from May 2nd to May 9th. And the 3-day lag also allows time for more complete data to come in and for us to ensure the accuracy of the numbers. Trying to report the positivity rate each day would show varying fluctuations in the rate. For example, if test results were largely from congregate settings where we have been seeing higher rates of positivity, you would see a much higher rate than what you would see in a broader slice of the population. So we continue to work day in and day out to provide you data in a timely manner, but we also want to make sure that we are using it with you, the public, to inform the actions that we need to take to reopen. Now let's turn to some of the latest data in the last 24 hours. To date, 471,691 tests have been performed, of which 29,266 were reported in the last 24 hours. Regarding hospitalization, 4,626 people were reported to be in the hospital with COVID-19, and of those, 1,215 were in the ICU with 730 patients on ventilators. Since yesterday, 4,014 new cases were reported for a total of 83,021 cases for Illinois. Unfortunately, this includes 144 additional deaths for a total of 3,601 lives lost to COVID. I know some people have had concerns about the number of COVID-19 deaths that have been reported. Some are concerned that the numbers are inflated. Others think that the numbers reflect an underreporting. In Illinois, we are reporting those deaths that have laboratory confirmation, meaning that they have been tested and a laboratory confirmed test indicates that they were COVID positive. As we learn more about the disease, there may have been less typical presentations of COVID-19 that were not appropriately attributed to COVID because there wasn't a test done because the suspicion was not there. There is also some additional deaths that happen in someone who happened to be COVID positive, but where the COVID infection had nothing to do with the deaths. So we are at IDPH trying to remove those obvious cases where the COVID diagnosis was not the reason for the cause of death. So if there was a gunshot wound, an acute gunshot wound, if there was a motor vehicle accident, we know that that was not related to the COVID positive status. But in a case where someone was elderly or battling cancer, it is obviously less clear that the COVID-19, the disease associated with the coronavirus, didn't actually play a part in hastening the deaths. So those deaths do stand. Individuals who do test for positive for COVID-19 and die with illnesses or complications caused by the illness are definitely COVID deaths, and those continue to be counted in our count. We will continue to work to provide data quickly and responsibly and accurately represent what we are in fact seeing here in Illinois. We will continue to stay the course, and we ask you to do the same. We have to do this together. Let's keep going on. For every person's life matters, and we're doing this for all the communities across the state of Illinois. And with that, I will summarize my comments in Spanish. Buenas tardes a todos. Hoy empiezo con el número de positividad en todo el estado, que es 18%. Es importante tener en cuenta que el número de positividad se calcula continuamente por 7 días con un retraso de 3 días. El retraso de 3 días nos da tiempo para que ingresen datos más completos y para que podamos verificar los números para una mayor precisión. La razón de esto es para ayudarnos a identificar una imagen más precisa de lo que estamos viviendo. Intentar informar el número de positividad cada día podría dar una imagen inexacta de la cantidad del virus que circula en su comunidad. Estamos trabajando cada día para compartir datos lo más rápido posible, pero también queremos reportar en manera responsable. Esto ayuda a informar qué acciones debemos tomar para volver a abrir el estado. Y ahora más hechos de las últimas 24 horas. 29,266 pruebas fueron reportadas en las últimas 24 horas. Al respecto a las hospitalizaciones, se informó que 4,626 personas estaban en el hospital y de ellos 1,215 pacientes estaban en la unidad de cuidados intensivos y 730 pacientes estaban en ventiladores. Desde ayer se reporta 4,014 casos nuevos para un total de 83,021 casos de COVID-19 en Illinois. Esto incluye tristemente 144 muertes adicionales reportadas desde ayer para un total de 3,601 vidas perdidas. Sé que a algunas personas les preocupa la cantidad de muertes de COVID-19 que se reportan. En Illinois estamos reportando sobre las muertes confirmadas por laboratorio. Eso significa que han sido analizadas y un laboratorio confirmó que la prueba fue positivo por COVID-19. Las muertes en las que la persona dio positivo por COVID-19, pero no se cree que su muerte sea causada por el virus, se consideran asociadas a COVID-19. Ejemplos de esto incluyen individuos que dieron positivo para COVID-19, pero murieron por alguna otra cosa, como un accidente automóvil, un homicidio o un suicidio. IDPH no incluyen esos números en sus reportes de muertes sobre COVID-19. Las personas que dan positivo por COVID-19 y mueran por esta enfermedad o complicaciones causadas por la enfermedad son muertes relacionadas con COVID-19 y están incluidas en el número de muertes. IDPH continuará trabajando para proporcionar datos de manera rápida y responsable que represente con precisión lo que estamos viendo en Illinois. Por favor, escúchame. Todavía tenemos que seguir el paso. Por lo que tenemos que hacer juntos. Lo haremos por cada persona, cada comunidad y por todo Illinois. Muchísimas gracias. And with that, I will turn it over to Governor Pritzker.
Thank you very much, Dr. Ezike, and I very much appreciate your report and, of course, your translation into Spanish. I want to begin today by speaking about just the number of tests that were done in the last 24 hours, because it's worth noting. I don't think Dr. Ezike got to announce this number, and it was 29 tests. And although some of those that were not a prior day, the over 20,000 of those were performed in the last 24 hours. So we're very pleased with the progress that we're making on testing. Throughout this pandemic, I've said, and Illinoisans know, that the battle against the virus has been fought on two fronts: that of public health, of course, and to preserve the economy. The damage that this virus has done to jobs and businesses has really been devastating. National projections show some industries will begin recovering in the reasonably near future, and still others may take longer. Meanwhile, workers and their families are hurting. Federal relief has helped in the short run, and the state's support systems have provided a safety net to address the immediate financial pain. From early on, my administration has worked to support our residents and small businesses by banning residential evictions, by providing help to pay rent and utilities, delaying tax filing deadlines, expanding unemployment eligibility, and instituting loan and grant programs to support small business owners. But that isn't enough. We must do more. The legislature must convene so that we can begin to put our financial and economic house back in order, even as we battle this terrible virus. The General Assembly needs to pass a comprehensive plan to support families, small businesses, and small towns. The Congress is looking at supporting the states, and we need to make sure that we are supporting the people who make our economy go. In addition to significantly increasing rent assistance for families and working with banks on mortgage forbearance, we need rent and mortgage assistance for small businesses too. We ought to provide grants and loans for businesses starting and restarting, and tax credits for small business job recovery. Industries and businesses left out of the federal PPP should be first in line. And we must pass a law to distribute funds to small cities and towns to support their need to fund first responders and basic services that could fall apart from COVID-related revenue losses. As we work to keep our residents safe and gradually reopen businesses, I hope the legislature will act expeditiously to support jobs and economic recovery. Until then, I will continue to implement programs that are within the purview of my role as governor. To that end, today I'm announcing a program to provide $25 million in DCEO grants to help local governments jumpstart public infrastructure projects for the summer construction season. These grants are part of a $50 million program through Rebuild Illinois that we're expediting to help cover local projects that may have otherwise been canceled due to revenue loss related to COVID-19. This will keep key public infrastructure projects in the pipeline and will support the return of skilled labor to job sites for the busy summer season. Starting today, local governments with shovel-ready projects, including school districts, townships, and other entities, can apply for this funding. For those that need more time, the additional $25 million will be available through June 30th. I encourage representatives from any community in the state to contact DCEO for assistance. Funding will be prioritized to underserved areas and projects located in opportunity zones, though all communities are eligible. DCEO will begin to host webinars this week to assist local governments in the application process. Information on sign up is available and will be available on the DCEO website. As a reminder, more than $90 million was made available to small businesses through DCEO in response to COVID-19. Our $14 million in emergency hospitality grant funding was distributed to 700 businesses across more than 270 cities and towns in Illinois, providing help to restaurants, bars, and hotels to keep up with operational costs during this immensely challenging time. And DCEO is still offering tens of millions of dollars through two additional sources of support for our residents: our Emergency Small Business Loans Program and our Downstate Small Business Stabilization Fund. These programs can be found online at coronavirus.illinois.gov or on DCEO's website. I also want to highlight a new source of financial support out of the Illinois Department of Healthcare and Family Services to help our hospital systems, many of which are facing a shortfall in revenues due to their need to provide capacity for the potential influx of COVID-19 cases. This hospital stability payment program runs through the end of June, and HFS has already begun the distribution of $75 million to hospitals across the state of Illinois. The last 2 months have made exceptionally clear how critically important strengthening our hospital system is for communities across Illinois, not just in times of emergency, but as a continuous source of medical support for our residents, as an employer, and as a way to put an end to long-standing disparities in healthcare access and delivery. Our healthcare providers are seeing us through this fight against COVID-19, and I'm committed to ensuring their long-term survival and success in every way that I can. So I appreciate very much everybody tuning in. Thank you very much, and I'd be happy to take any questions from members of the press.
Jim Williams with CBS is our first pool reporter.
Good afternoon, Governor. From my colleague, Tara Molina of CBS 2, we've heard from dozens of people who have waited 6 to 8 weeks for their key bank debit cards. They cannot access their unemployment benefits and they can't get through to Key Bank for help. Specifically, what are you and IDES doing to fix this and make sure Key Bank is doing its part here?
So we've been in contact with Key Bank. They certainly have the obligation here to do what's right, to make sure that those cards are being charged appropriately. That is to say that there are deposits made in those accounts. Many people, though, received cards that do not associate with an amount that's in an account, mainly because those cards are distributed even before people actually qualify for unemployment insurance and unemployment benefits. So there are people that have not gone fully through the process who've received a card and may not be able to use that card because they have not been confirmed as an unemployment benefit recipient.
From John Garcia, ABC 7, he would like to ask you about the letter you received from Elmhurst Mayor Steve Morley yesterday. A number of mayors in DuPage County would like to reopen their towns. They say they don't want to be lumped into the Chicago area. They claim they are much safer and are able to reopen safely. And Phil Rogers of NBC5 adds, the mayor says their numbers show different trends and that it really is not appropriate for them to be included together.
Sure. Well, I'll reference you to the comments that I made yesterday on this exact topic. And that is that everybody would like to draw a different map. There's no doubt about it. We wish that there was a federal plan, a national plan for reopening, but there isn't. And so it's been left to the states. We, in fact, decided that it was very important for us to operate in a regional fashion. Some people would like to open city by city or town by town, county by county. That's 102 counties, 1,200 to 1,300 towns and cities across the state of Illinois. It was important to us to make sure that on a regional basis, we were, in fact, noting the differences from one area to another, and we did that. But remember, the regions are drawn in a way to take into account hospital availability, and to follow the metrics for each region appropriate to a region that is near a large metropolitan area like Chicago. Many people that live in DuPage County work in Cook County, travel between the two, and that's one of the reasons why there's a danger to people who live very nearby, because as they travel to and from work, they have the potential to carry the virus back and forth. So I appreciate that everybody's got a different idea, but I will say this, that if you follow the regional metrics, that each of our regions, including the Northeast region, which includes DuPage County, is reasonably speaking on track. I mentioned yesterday, all of the other regions are on track to meet all of the criteria, and the Chicago and Northeast region are very close. And it is a 14-day metric on the COVID positivity number. And in fact, that number is heading south. So I would just keep an eye on that number, and that will allow those areas to open up sooner. But take note that it's a 14-day measurement for that.
Governor, we have reporters or questions from 3 reporters approaching the same theme. Cisco Cotto of WBBM News Radio, what are your concerns about Indiana reopening sooner than Illinois? And does that mean Midwest governors are no longer working together on reopening plans? Elizabeth Matthews of Fox 32 is asking about Wisconsin. Have you talked to Governor Evers? Wisconsin has essentially opened up all retail today with extreme restrictions. And from Lourdes Duarte of WGN, what are the conversations like with those governors? How concerned are you about people traveling to some of those other states?
That's a lot of questions lumped together, I know. Let me start by saying that as governors in the Midwest, our Midwest region, we talk to one another and our staffs talk to one another quite frequently. We are sharing ideas and making sure that we're following best practices. It is different from one state to another. Indiana is a different state than Illinois. We have different concerns, and Michigan's different as well. So is Ohio. So each of us have different timetables. It's, again, based a lot on, at least for Illinois and for many of the other states, based on healthcare metrics. So we're following, you've seen what we've put out as a Restore Illinois plan. It is, if you look at what the president's plan is, where you would have to have all the numbers dropping over a 14-day period, ours is actually somewhat easier to meet that plan would be. We might open the state, if we were following the president's plan, Illinois might open at a later date than the one that is currently set in metrics. Having said that, each state is slightly different. And our Midwest Compact is really about a shared set of ideas and a shared set of principles for contemplating reopening. Doesn't mean that we're going to have exactly the same timetable. And indeed, like I said, much of the state, it looks like, maybe the entire state, will begin to move into phase 3 at the end of May, which is just a couple short weeks away.
Have you had conversations with those governors, the governors of Indiana and Wisconsin, and are you concerned about people traveling to some of those states?
I am concerned because I think that in many ways that opening too early or the potential spread of the virus in those states will affect our metrics in Illinois. So I understand that people may cross over the border, but I think they should take into account the danger, the potential anyway, for the spread of the virus and their ability to carry that virus back over the border when they come back, bringing it to their family and their community, affecting not only the health and safety of people in that community, but also the ability of their region to meet the metrics that we've set.
From Greg Bishop of the Center Square, what is the state doing to make sure there will be enough accessible, affordable, and available child care for people to return to work in phase 3 of your plan, even though daycares won't reopen until phase 4? And will children and child care workers be required to wear masks and socially distance?
Well, we in fact have opened child care, as I think Greg knows and others know. We put in place what we referred to as emergency childcare, which really was a downsized version of existing childcare facilities. We didn't think it was safe, and the doctors, most importantly, didn't think it was safe to allow dozens and dozens, potentially 100 children to populate a single childcare facility. So what we did was sought out the creation of smaller emergency childcare providers. And there are 2,500 of those, indeed more than 2,500 now. Many people continue to sign up to do that, existing providers. They actually get paid more on a per child basis than they were when they were running their larger facilities, because we wanted to make up for the cost of having a smaller number of children in each class. So we believe that we will have childcare available to people who will go back to work with phase 3, but we also have created a task force to make sure that we're creating as much childcare as will be needed in that phase and beyond.
From Amy Jacobson of WIND Radio, on a daily basis, you mentioned the models, the science guiding your positions and policies, yet aren't these the same people who are wrong about the hospitalization rate? Remember saying 40,000 people would be hospitalized in late April, when in actuality it was 4,800. Why not consult other models and scientists?
Well, actually, Amy, I think you missed the point of it. We have consulted scientists and doctors all over the country, and we continually ask those, not just in Illinois, but elsewhere. Now, you may have noticed that some of the models, including the one used by the White House, has changed quite a bit over time. The projections for Illinois were so much different over the course of the last 2 months. They've changed continually. One of the reasons that the number of deaths and the number of cases has gone down in Illinois is because of the mitigation efforts that we put in as a result of what we could see were the projected numbers, the projected cases, the projected hospitalizations and deaths. So we knew that we needed to make the stay-at-home order, to build it in a certain way to make sure that we had face coverings required, for example, which helps to bring down and bend that curve. So we're actually doing quite well with the advice that we're getting. Our models have been very helpful. And as you well know, every day that we have new information, it gets plugged into the model and it affects the shape of the curve. So it's not, remember, I gave an entire set of remarks maybe a week ago about the full understanding of how a model works. So I would refer you back to that.
Chris Coffey of NBC5, are there any state of Illinois plans to assist the landlords who are being impacted by missed rent payments? Is the state in favor of proposed city rent relief ordinances that would give renters a year to pay back rent, for example?
Well, I'm not sure the state is going to take a position on a city proposal, but here's what we're doing. We are providing rent relief at the state level through the Department of Human Services and as well as utility payment relief. We also, as you know, have banned evictions in the state during this crisis, and we've also gotten a moratorium from the major utility providers, a moratorium on shutoffs. So we've done quite a lot. I think we need to do more, and I'm calling on the legislature, in fact, when they get together, to increase the amount that we're providing for those relief programs, particularly for rent relief, because there's so many people who are struggling right now to pay their rent.
On economic recovery. Restarting the economy was dependent on healthcare capacity and getting the virus under control, and I am confident we have done just that. We're glad to see Missourians begin to safely re-engage in the economy, and we are thankful for the businesses across the state that have stepped up and implemented new measures to keep employees and customers safe. COVID-19 has had major impacts, not just on public health, but also our economy. If you remember a week ago, I mentioned that PPE Marketplace my administration created was recognized by the White House as a best practice around the country. Yesterday, we received a call from the Supply Chain Task Force inquiring about Missouri's manufacturers that are producing PPE and the interest in utilizing American manufacturing to fulfill PPE orders and decrease our reliance on such items from overseas. This is incredibly promising, not only because it shows President Trump's administration is following through again on an effort to revitalize American manufacturing and American businesses, but some of the businesses that may be helping are Missouri companies and small businesses, and that is exciting news for our state. Although we have some hurdles to overcome, Missouri is headed in the right direction. Through May the 1st, Missouri has 78,733 businesses receiving a total of $9.24 billion in Paycheck Protection Program assistance from the Small Business Administration. We are also continuing to explore opportunities within federal stimulus funds to assist businesses with training and workforce needs as they modify operations and make accommodations due to COVID-19. The Department of Higher Education and Workforce Development is launching the Recovery Mode campaign on May the 18th, focusing on the following items. Missouri Job Centers will pivot in the coming weeks from assisting the Department of Labor with unemployment claims to helping Missourians skill up and get back to work. Many people receiving unemployment benefits will qualify for training programs. Team members from the Missouri Department of Higher Education and Workforce Development will be available to help Missourians find and enroll in training opportunities. Short-term training programs from Missouri higher education institutions that will allow Missourians to quickly earn a certificate of industry-recognized credentials will be highlighted. We will host virtual job fairs, help Missourians update their resumes, and most importantly, find meaningful employment. Recover Mo will also include a regional approach to safely reopen job centers to staff and the public. Also, the Department of Higher Education and Workforce Development received word on May the 11th they will receive an emergency $1.3 million grant for COVID-19 disaster recovery from the United States Department of Labor. The grant will help the department target dislocated workers across the state. It will be allocated to the local workforce development boards for their local response. The grant will create temporary employment opportunities in humanitarian work such as healthcare workers, contact tracing, and other work directly supporting COVID-19. Temporary employment for job center services and training opportunities. The grant money will be awarded on June the 1st to the department and will be available to the local workforce development boards within 45 days. Missouri citizens and businesses are eager to get back to work. And now more than ever, they need our support to get back on their feet. Economic Development Director Rob Dixon and his team have worked very hard to create a broad-based plan that drives the economic and community recovery across Missouri. This business plan never loses focus on businesses, communities, citizens, and infrastructure, and we will continue to focus on these areas as we move forward. Director Dixon is here now for an update on Missouri's economic recovery plan. Rob?
Thank you, Governor. You know, the word unprecedented has been used to describe just about everything related to COVID-19, and that's because just about everybody that's alive today has never experienced anything like this. The impact of COVID-19 on our economy has been unprecedented too. Unlike almost every other economic shock that our nation has faced, this one was not caused by economic conditions. Financial systems didn't fail, bubbles didn't burst. Instead, it was the public health threat itself that brought our thriving economy to a standstill. We know that our way forward in terms of public health and in terms of economic recovery are linked together. In fact, they are two sides of the same coin, And that's why our economic recovery efforts are rooted in our public health response, as the governor outlined. Last week, Governor Parson announced the beginning phase of our Show Me Strong recovery plan, which allows for the responsible and safe and gradual reopening of economic and social activity in Missouri. That plan was based on 4 healthcare pillars: expansion of testing, increasing PPE reserves, adequate hospital capacity, and the ability to use data to predict the future course of the virus. We have provided information on these in recent press briefings, and you can find the detailed data and analysis at health.mo.gov. But it's because of these pillars that we are able to gradually reopen our economy today, and I wanted to talk a little bit about why that matters. You know, last week, the federal government announced that the national unemployment rate was nearly 15%. And that means that nearly 22 million Americans have been put out of work since the COVID-19 state of emergency began. The state-level data will be released soon, but I think the trends will be somewhat similar in our state. Some industries have been hit particularly hard, including retailers, restaurants, manufacturers in particular, but no community in Missouri has been unaffected by the economic impact of this. And that's why the governor's Show Me Strong recovery plan is so important. It provides a path forward to safely and responsibly engage in economic and social activity in our state. The virus is not going away anytime soon. We're going to have to learn how to safely and responsibly conduct business in this era of the new normal that we're facing. If businesses, employees, customers, if they all continue to practice good mitigation techniques like social distancing, like modifying the physical workspace, additional sanitation, shifting work schedules, and things like that, we'll be able to engage in additional economic activity. As we continue to monitor the data and watch this changing situation around us, we can look toward the next phases of our economic recovery efforts. Governor Parson has asked that every state agency continue to work together as we do so. Across the entire administration, state agencies are working together to develop and institute resilient and sustainable economic initiatives that promote prosperity in our state. And as was outlined when we initiated the Show Me Strong recovery plan, we are focused on helping Missouri's citizens, communities, businesses, and infrastructure. This is not a short-term recovery effort, and it will always be connected to our ability to deal with the virus. In the next phase, we're going to continue to drive forward by increasing the resiliency of our state. And that's because we need to continue doing business even before a vaccine is ultimately developed. So that means we'll be looking at plans and policies that can be carried out both in the private sector and in government. We'll be looking at opportunities for nonprofit organizations and philanthropic efforts, and we'll continue working with our local government partners. The Show Me Strong recovery plan provides a path forward, and you can find additional information online at showmestrong.mo.gov. Thank you.
Rob, thank you for what you and the department over there has done, economic development, the many roles you've taken on as director this year and your people that we've asked you to do so many things during this time, and I appreciate it because, as we all know, just a little over 60 days ago, we were probably riding one of the highs that we've ever had in the state of Missouri when we were actually, the economy was going and we were doing a lot of things in this state when it comes to jobs and infrastructure, and here we are today, but I'm confident those days will be back. Those days will be back because of what we're doing in this state. I just want to say I appreciate everyone for listening again today. And as I conclude, I want to again thank many Missourians for their efforts and commitment to Missouri during these times. And we must all continue to work together to move Missouri forward. Last night I had the opportunity to see the news, which I hadn't seen for, seemed like a long time. And they had different states of the way the people were acting in the states, whether it was on the beaches on the East Coast or whether it was big groups together on the West Coast in different parts, and I'm thankful that I live in Missouri. I'm thankful for the people that have common sense. I'm thankful for the people that work hard every day and do what they're asked to do. And that's why our state, I feel like, is so much better off than a lot of states around us. It's simple because people do what they need to do to protect themselves. And when you really look at it, what I've seen over the last 60 days, how important that is for all of us to do what we're asked to do. And we take that upon ourselves as citizens to do that. And, you know, over the last 60 days or so, there's been many things said, pro and con, about the way you do this job sometimes and how things occur. There was a gentleman that sent me a little note for well over a month now, and I just want to mention him. He's and say thank you. He's from Cape Girardeau, and his name's Doug, and he has sent me notes in the mail since March defining words of encouragement for my staff and me. Yesterday's note is one that I want to share with all of you. And the word he used yesterday was intentional. And the definition of intentional: deliberate, planned, intended, purposeful. And it goes on to say, certainly, these are words that describe your team's action during these trying times. The way your staff presents themselves does wonders to instill the challenging to be safe, not scared. Winston Churchill said, "We make a living by what we get. We make a life by what we give." It is plain to see what you and your staff are giving as you help to move us through this crisis. And I want to thank Doug for sending that, because believe me, there's been other notes that's not been so flattering that we received at this office. There's one thing I do know, the old saying, damned if you do and damned if you don't. I've lived that scenario for over 60 days. This office has, and the people that work here. Every day we tried to make decisions on what we thought was best for the state of Missouri. Not because sometimes what the media thought we should do, not what social media thought we should do. We tried to get the data that was in front of us to make the decisions that we made every day. And I'm thankful for those decisions, what we did make, and how this state conducted itself. And let me say this, it wasn't government that made Missouri so good during this last 60 days. It was the people of this state that abided by what they were asked to do. And government didn't have to tell them to do that. People were smart enough to know, I need to be careful. I need to take risk out of the game plan. I need to take care of one another. And as I see that throughout the state and continue today as we go into the recovery process, it just makes me know how proud I am of the people of this state and for what they really stand for when I look at other states around us and what that's meant. So with that, I just want to recommend everybody, encourage you to keep up social distancing. We still got to fight this virus, and we still got to open up this economy. And I am confident Missourians will do both, and we're going to be better off in the days to come. So let me just finish by saying thank you. Thank you to all Missourians, and God bless. And also, Dr. Williams with us here today for questioning. So, Kelly, if you want to open it up for questioning for Director Dixon or Director Williams, it's open up.
I have a question for Director Dixon. And so when you say that there's going to be workforce development funds coming out, how will you decide how to allocate those to different localities in those 45 days?
Sure. So the programs that the governor outlined are actually overseen by the Department of Higher Education and Workforce Development. So their agency will work with our local workforce investment boards, the colleges and universities that oversee those funds. So they will do that according to our workforce demand. Overall, as the governor talked about, all state agencies are focused on driving resources, whether it's federal, state, local, whatever it is. We're trying to make the most strategic use of the resources that we do have available to us. And obviously, getting Missourians trained and retrained was important before COVID-19. It's going to be even more critical after the period that we're in right now, because fundamentally the way of doing business is going to change. And that means we're going to have new skills that need to be taught. Folks are going to have to learn basic things that they didn't have to do before to get back to work. So that's how that'll be handled. Thanks.
Yes. I will just say very quickly to reiterate what Rob and the governor said. Today we only had 88 new cases. Yesterday we only had 74, so we think we're trending down. And as the governor said, that's really a tribute to the people of Missouri. We can set a path, been very intentional, but the people have to follow it, and they've done. So the credit for that goes to those people who've done that, and we're just incredibly appreciative for that. Thank you.
Thank you. One other thing to clarify what Dr. Williams just said too, there was a spike in deaths today. You've all reported that, I see out there, but that was due to one of the counties in the state not turning in that death information for, I think, was it a week or two? Was it a week or two behind? A week or two behind, so that's what it was. But the good news is things are trending in a positive direction in the state.
Governor, on the issue of Missouri companies manufacturing PPEs, there's been some debate in the legislature over whether Missouri companies should be given tax incentives to do that. Do you think that that's something that's needed to produce enough PPE for what you're looking at?
Yeah, you know what? I think it's early to decide whether you do anything like that or not. I think the main thing is that I think is so encouraging is the federal government is looking at Missouri to be one of those manufacturing states. And if we know anything about the federal contracts that we see, most of those contracts are long-term. A lot of times they can be 15, 20-year contracts. So that gives an ability for people to invest in their own businesses. But you know what? Those business opportunities will be just like anybody else coming to this state. If we've got something to expand that, we want to help businesses here. Let me just say what we should be focused on right now. We should be focused on getting people back to work. Over 400,000 people on unemployment. I think those numbers are kind of starting to creep down a little bit, which is also good news. But we got to figure out how to fight the COVID-19. We got to bring our economy back. Those three pools right there should take priority of anything else. So how we get jobs back, how we the incentives and all of that kind of stuff. Look, right now we need to get everyday Missourians back to work. We need to get our businesses up and going, and whatever that takes, we ought to use all means we have in the toolbox to do it. All right. Thanks, everybody, today for being here, and look forward to seeing you back tomorrow. Thank you.